This is Dr. Matt Parker with Roanoke Animal Chiropuncture. Welcome to our new series titled Chronic Health. We plan to use this series of relatively short episodes to try to explain why we have so many chronic health issues in our society and what we need to do to fix these problems. So you've already noticed I'm using words like we and us and our because all of these topics affect all of us, and the ownership of our health and healthiness and well-being belongs directly to us and nobody else. And the ownership of your pet's health belongs to you, not the breeder, not your veterinarian, and not your pet's hairdresser. Now, before anybody gets mad at me, let me clarify. Your pet absolutely needs his dense undercoat brushed out, and he needs his inappropriately long hair trimmed to prevent matting and skin disease and other infections. And he needs his toenails trimmed properly. And it's true that your breeder and veterinarian and groomer all possibly or likely have some great advice about holistic health and the health of your pet. But ultimately, my point is it's your responsibility, and you need to do your own research and you need to come to your own conclusions about your pet's health. So yes, I'm a veterinarian, and I'm primarily trying to address chronic disease issues in our pets. But the concepts I'm going to address apply basically to all living things. They certainly apply to all mammals. And for the record, folks, just like dogs and cats, we as humans are mammals. So I'd like to turn all of our chronic health problems into long-term healthiness. I'd like to reverse chronic disease, prevent chronic disease. And there are many different approaches and targets to doing this, many different approaches to health, healing, and to healthiness. We're going to start with an example of just how complicated it is, though, okay? So we're going to talk about chronic disease in the 21st century. Why is it so rampant in people and pets, and why is it so difficult to get rid of? The example we're going to use is about how it's different today than it was 100 or 200 years ago. Around 1900, back during the Industrial Revolution, you had a lot of people moving from the rural areas, rural farmland, small communities in the United States and all over North America, moving into big cities, the big urban hubs like Chicago and New York City. And you also had people coming from all over the world. You know, these people came with immunity to the flus and pneumonias and colds that their community commonly had. But they were exposed to all these people in crowded conditions, like in the really dirty, terrible conditions of the Chicago slaughterhouses. They're exposed to diseases or different strains of diseases that they didn't have immunity against. So everybody's getting sick just because of the proximity and the crowdedness and how dirty things are. It's probably similar to what we learned in elementary school about the Spanish conquistadors who introduced smallpox and flu and other diseases to the naive immune systems of the indigenous peoples of Central America in the 15 and 1600s. It's not that these diseases were that bad, it was that these people had no immunity. They had never seen these diseases before, and it wiped out, I don't remember, something like 90% of these indigenous populations. So these diseases, flu 100 or several hundred years ago, or a cold or pneumonia, it just needed a simple antibiotic. People got sick because they were exposed to something they hadn't been exposed to before, and they were in overcrowded conditions where disease spreads easily. Simple single antibiotic or antiviral or medication would cure those diseases. It's different today. I'm going to give an example. I really like this example. I'm stealing this directly from a neurologist that was on the People's Pharmacy, Joe and Terry Graydon on NPR. Their show number 1132 was about Alzheimer's disease a week or two ago. I think Alzheimer's disease in people is a really good example of chronic disease in people and pets, of the way all the chronic diseases work. So this neurologist was talking about how we keep coming up with new discoveries and new studies and new reasons or cures or suspected smoking guns for Alzheimer's disease. But he said, he used the analogy, Alzheimer's disease is like having a leaky roof in your home. There's 36 holes in the roof. So every time you find a new hole to plug or fix, that's great, that's helpful. But you're still going to have a leaky roof until you plug all 36 holes. And that's the way Alzheimer's disease is, and that's the way all chronic disease is. There's not a single smoking gun. You have to find all of the contributing factors and fix them all before you're going to stop the disease, which is the leaky roof. So examples about Alzheimer's, you know, we've known for years about amyloid deposition in the brain. This neurologist was saying that that amyloid deposition is probably not a bad thing. It has a job. It's antimicrobial and it's sequestering bacteria to protect the brain. But in its process of protecting the brain, it does cause some fogginess and Alzheimer's symptoms. There's other bacterial and autoimmune suggestions. But like I said, this is an excellent analogy of how all chronic disease works in ourselves and our pets. There's not one magic bullet. You have to truly take a holistic approach to address every known aspect of the problem. And then you need to give the body the resources it needs, which is primarily proper nutrition, so they can deal with the unknown number of unknowns. So, yes, the unknown number of unknowns. Just because we know there's 36 holes in our leaky roof and we're trying to plug all the holes, doesn't mean that there aren't more holes we don't know about, or more soft spots where things are leaking that we haven't found yet. So we have to give the body the resources it needs to heal those things that we don't even know are a problem yet. So the point is, when it comes to reversing and preventing chronic disease and maintaining the health of our pets and ourselves, there is no single smoking gun solution. There's almost an infinite number of factors, and there's no way that we'll ever identify what all those infinite factors are. So what do? That's what this series is designed to help us explore. There are answers and solutions, but first we have to identify the broad categories of problems that need to be solved, and we have to understand them. And that is what this series is intended to cover: the broad categories and general concepts that we need to address in order to turn our chronic health problems and chronic disease into chronic health or chronic healthiness. So look forward to another episode. There'll be more short episodes coming where we'll start delving into all the big categories of things we need to address to start getting ourselves and our pets healthy again. Thanks for watching.